Hello guys, in this video we'll be talking about how to approach and review GTs. So GTs are basically the grand test. So when you watch any top interview, everyone stresses upon the importance of grand test, but actually no one tells you how to review. So I'll tell you the best way to review your GTs. So which platform to practice GTs, guys? Any platform that gives you a free GT, go and practice. Be it any other platform you are using, guys, just go and use. So you will have better Arizona of question, you can practice more. So what is the best time to start for GTs and how to approach GT, guys? Okay, so mainly in this video I have used Mado and Unacademy. I have used till now, I have given test of these two platforms. So I'll be explaining with the help of few sample questions that were asked, that how did I review the question, what were the mistakes that I made through. So first of all, guys, please don't have FOMO. Whether your friend is practicing from A platform or B platform, please don't compare, guys. Okay, there the number of different students might be different, the level of questions may be different, so please don't have FOMO. Okay, so the best thing you need to remember, guys, there is no such time where you will say your syllabus is finished. So you need to start at some point of time, otherwise you will miss out. You need to have the habit of practicing question so that you know how to manage your time in those 3 hours. So managing time is very important. So now see, so this was my GTs that I attempted recently in Mado. This was on the 10th November, and this was of the 20th November, you can see, guys. Okay, so recently we had 2 GTs in Mado. Okay, so the first GT that I attempted, guys, I got a score of rank of 10,776, and after 10 days the next GT that I attempted, guys, I had a score of 5849. So guys, what does this say? You need to continue working hard. It's not about, we are talking about the average student, we are not talking about the toppers who topped entire in their MBBS life. So we need to think about the mediocre ones. Okay, so it's not that I did very well, but like you need to take a step somewhere. So currently I'm in my 4th year of MBBS. I started attempting GTs because this is the time you need to start. Even if you have not started, better late than never. You need to start at some point of time. So because if you wait on completing the syllabus, it won't end ever, guys. Okay, so first of all, whenever you are giving GT, guys, believe in yourself. Whatever you are doing, it's fine. After GT, it may feel like you are demotivated. Okay, so try to have a good food, go out with your friends, spend some time. That will make you feel good. What is the advantage of this GT, guys? Okay, you see, I guess some questions, guys. See, I guessed 49 answer in which I got 21 correct. Guess means which I was not very slightly sure or less sure. Some of them which I thought to try my luck, guys. Okay, so you get to know how much is your guessing sections working fine for you. And I changed 14 answer, you see, guys, and I got 14 correct. Means most of the time, guys, what happened? Like many a times I see that first instinct works the most. Like today I had a test in my college on leprosy. Okay, and the question was there, which one of the following is specific to mycobacterium? Okay, though the quiz was on leprosy, so accordingly the answer should be phenolic glycolipid, but it was written mycobacterium. I marked the answer as LAM, that is lipoarabinomannan, because it was mycobacterium, but the quiz was on leprosy. So I overthinked. If I might have not have overthinked, guys, I might have done the question correct, guys. So do not overthink. Now see, what is the advantage of this GTs, guys? You need to know your strongest subject, guys. Do you see? And in this GT, my weakest subject came out to be radiology. Why? Because still I'm in 4th year. I have not read my radio. I have not watched any of the video. So that is bound to come. You see, so you need to know where you need to work hard, stress more. Okay, so that is important. See, this was the recently I gave Unacademy Medmind's Combat. Okay, so I attempted the second year, since this was even before my Madowala test. So this was the first combat that I was attempting. So I slightly was more confident in my second prof subject. So you can see I attempted Path, Micro and Pharma. Pharma I have started now. I have not completed a major chunk of it. You can see that reflects in the score. Path and Micro were slightly on the better side. You can see the score, guys. Okay, so you need to start at some point of time, guys. Okay, now the most important part is how to review your GTs. Okay, so see, there are, I have classified the questions into various, like what are the silly mistakes, whether it is a known fact and you could not recall, whether it is due to lack of revision issue, whether it is a problem in image based question or the staging question. So we'll talk about each and every segment. How do you need to review your GTs? Okay, see, suppose this was a this is the first segment where we said this was an easy question, or you knew the question, or you can recall the concept, guys. See, This was a simple question. They said PLA are 2 positive, guys. Okay, so if you know, guys, this is like you need to memorize, guys. This is membranous nephropathy. If you know, guys, you can write the answer, guys. Okay, see the next question, guys. The test was positive for OXK, guys. Okay, in my microbio video, guys, I have already said, guys, in my rickettsia wala video, SC. How do we write, guys? SKRUB. That is K positive, guys. That is scrub typhus, and scrub typhus is due to mite, and it is transmitted due to mite, and it is caused by Orantia shushugamushi. So the answer is shushugamushi. But you see, this was my first GT and I skipped this question. Even though I knew the answer, guys, but I missed it out. So please, this gives a very important lesson. Try to see that you do not miss out some question, guys. So try to attempt your GTs with a cool, calm mind, guys. Now coming on to the second one, that is the recall error due to lack of revision, guys. Okay, see, if we read this question, guys, they gave us a Renault phenomenon. They ask me antibodies. When you read this in the question, guys, you come to the diagnosis of, guys, basically systemic sclerosis, guys. Okay, when you come to the diagnosis of systemic sclerosis, when I heard the term Renault phenomenon, I thought about the CREST syndrome, guys. Okay, so if you see the CREST, guys, C is calcinosis cutis, R is Raynaud's phenomenon, E is esophageal dysfunction, S is sclerodactyly, and T is telangiectasia, that is the dilated vessel. See, do you see, guys, when you read the history, guys, they give a history that it appears firm and indurated on palpation, that is sclerodactyly, guys. Okay. But what did I confuse, guys? I confused it with limited and the diffuse, guys. See, they gave a mild Raynaud's phenomenon, guys. Okay, so this mild Raynaud's phenomenon, guys, they gave you, guys. See, there is diffuse, guys, and there is limited one, guys. Okay, so if you see the answer, guys, when there is mild, guys, that is due to the systemic sclerosis diffuse wala, and for diffuse it's anti-topoisomerase 1, also known as scleroderma SCL70. But I missed it out. Why? Because I did not revise it for long. I read it in my notes, but I did not revise. So this is important. That is, guys, you need to revise. Do not make the same mistake again and again. Make a new mistake, that is good, guys, but do not make the same mistake. So here if you see, there is a diffuse and limited, guys. Okay, so diffuse and limited is anticentromere. Okay, so that is, you can remember like this, that is limited AC, that you cannot turn on the AC every time, otherwise the meter comes very high. That is limited AC, that is anticentromere. Then the other one would be topoisomerase SCL70. I got confused, so this is due to revision. Now coming on to the third one, you knew the question, you had slight idea, but the options were not so great. You could not find out the right answer. See, if we read the question, the patient was on warfarin, guys. Okay, consultant also says on adding heparin. We knows that consultant asks you to add heparin also. So what was the need of heparin despite he was on warfarin, guys? Okay, see, the things you have in the option, guys, that is shorter half-life, longer half-life. See, if you see the longer half-life of factor 7, this is absolutely wrong. Why? Because factor 7 has the shortest half-life. How do you remember the half-life? That is, guys, 7, that is 7 hours. Okay, so this is bilkul wrong. Okay, now see, there is warfarin and heparin. So think about the mechanism of action, guys. Okay, so warfarin, how does it act, guys? It is basically the vitamin K ka antagonist wala. That is, it inhibits 2, 7, 9 and 10. And this heparin, there may be either low molecular weight or something, they have not, or unfractionated, they block factor 2 and factor 10, guys. Okay, so what do you come across this, guys? That answer will be something in this factor 2 and factor 10 wala. Okay, so this longer half-life of factor 7 is completely impossible, guys. Okay, so see, so now the answers come out to be, guys, longer half-life of factor 2. So we add it, guys, because factor 7 will decline very soon because it has shorter half-life. You can see the explanation. So that is important. You need to read the question and try to use your knowledge. Okay, so that is important. So the options were slightly confusing for me, so I made the mistake in this question. Now coming on to the silly mistake. This is my one of the biggest silly mistake, I'll say. The same image we read when we discussed our this necrosis wala part, when we discuss our caseous necrosis, which I discussed in my path lectures. Okay, when I discussed the caseous necrosis, I said it's found in TB, histoplasma and some other thing. So caseous necrosis, basically you see the presence of granuloma that appears cheesy white in color. This is how you identify this appearance, guys. See, they mentioned a TB. Okay, then they ask you, how does this granuloma, this caseous white appearance? So what happens, guys? Okay, this is basically This is basically due to the Th1 cells, guys. Okay, and Th1 cells, what does it release, guys? It releases interleukin 1, means interleukin 2, interferon gamma, this all thing. So this gamma causes the granuloma. I don't know by mistake how I marked this Th2 cells. Okay, so this happens during the exam, so you need to be slightly more careful when you come across this type of question. Some of the places you find the pearls, guys, that is very important. Non-caseating granuloma like sarcoidosis and Crohn's disease is very important question that can be frequently asked. Caseating granuloma, say TB, histo and other things. Foreign body berylliosis and silicosis. Then dark granuloma, important question for cerebral malaria. Okay, then stellate granuloma, you have cat scratch disease. Then you have donut granuloma in Q fever. So try to revise the important things, the pearls that are given or the treasures that are given in your explanations. Now coming to the next question. Okay, so this was a question in Unacademy Medminds Combat. Okay, this was a question of path. Okay, so this question, what happened, when I saw this question, they ask you what kind of necrosis is this. Okay, and they had shown a section of the left ventricle, means something to do with MIC, 70-year-old patient admitted to the hospital. Okay, something to do with acute MIC diagnosis. They have written you everything. Okay, so what is the type of necrosis they have asked you. Okay, so what is the conclusive evidence they have asked you? See, this thing, disintegration of ribosomes, this is not possible. See, the two options that confused me was this mitochondrial swelling, calcification wala and the nuclear fragmentation wala. So I got confused, but I thought that this is seen in cellular injury and this is seen in nuclear fragmentation. What was the sequence, guys? Pycnosis, karyodexis, then you have karyolysis. Okay, so this was but I got confused. But with the help of option elimination, I could mark it. But when I went to review it, guys, I watched the video solution. Unacademy GTs, this Medminds Combat have a good feature. They give you the video solution, guys. That helps a lot to revise, guys. So see, when I went through this, ma'am also discussed a new question. What is the stain that you need that helps to identify MI, guys? What is the stain? That is TPTC, triphenyl tetrazolium chloride. So there is a flipping of LDH enzyme. This was also discussed by ma'am. So you can discuss the question nearby also, that will help you a lot to revise. Now coming on to the next type of mistake, that is unknown points in your known concept. You know some concept you have read well, but the question they have asked you, that is maybe not in your notes, you missed it out. Like they ask us a question of ulcerative colitis, okay, and they ask me extraintestinal manifestation. I knew so many manifestation like pyoderma gangrenosum, erythema nodosum, primary sclerosing cholangitis, but I never thought that which one of the following can be treated by reducing bowel inflammation. Okay, so this was missed out by me. So when you see the explanation, guys, okay, so you need to add this point in your notes. Okay, so if you see, guys, there are two things that get benefited, that is erythema nodosa and cholelithiasis. So how can you remember it, guys? See, ulcerative, that is C comes, C for cholelithiasis and E for erythema nodosum. I think you will recall it now, that two things that get improved by treating the inflammation. So if you see this question, guys, most of the other student also got confused in the similar option. Means people were thinking on the same line, because these two are one of the most common manifestation of ulcerative colitis. So it's fine, you may make the mistake, but try to add these points in your note. If you get something new, that may be asked further. Now coming on to the entire new concept or new question or from an unread topic that you might have not read. Like if we see this question, the question was on Gleason score. Though I knew Gleason score is asked in one of the MCQs, but I have yet not watched the video on Gleason score. So I made the mistake, that was bound to happen, that I skipped the question. I did not skip. So what is there? You need to get to the question, guys. Okay, so it's the time you should know. So try to read the scoring, how it is done. Okay, and suppose if you are not able to understand, guys, that's very easy. Just go search on YouTube and you will get some great videos by great teachers. So try to watch that will help you a lot. Try to first understand from the explanation given. See, then again comes the importance of this pulse, guys. Okay, see, so what pulse, like Bloom Richardson score is for carcinoma breast, this is important. Duke's staging for colorectal carcinoma is important. Chang staging for medulloblastoma is important. See, Gleason's for prostate is important, guys. Then, guys, we have Robson for renal cell carcinoma. Okay, so try to read some of the important staging. Just see the names even if we don't go to the complete staging wala part. Now coming on to the next one. If you make a mistake to the image based question, that is H&E, hematoxylin and eosin picture, or the radiological images, maybe MRI CT. So the problem is that maybe you have not gone through the images, or maybe you might get confused. Like, see what happened with me in this question. Okay, so the two options that confused me, guys, was the mesenteric lymph node and the spleen. Okay, because I saw blue things, lymph node, and I just marked it, guys. Okay, but if you see it, guys, here you can see the presence of white pulp too, you can see the presence of sinusoids too. So this was basically the picture of a spleen. I made a mistake. So you need to see, do not get to a conclusion so fast. Try to see each and every corner of the image, guys. That will help you to reach an accurate diagnosis. So that is important when you see the image based question, guys. Okay, so this is how to approach a image based question. Now coming on to the question that is staging question error, or something like that is full ratta type topic, like we can say it like buri tarah ratto topics, as Janam ma'am say. Okay, so what to do in this topic? Okay, see, this was a question where they asked me about the staging. Okay, so what is the finding that will suggest you he's in stage 4 RCC? I saw that about the stage 4 RCC. So see, if you see stage 4 RCC, the answer is if it extends beyond the Chirota's fascia. But I marked involvement of vena cava, that is in the stage 3. So it's common. You can get confused. But these things are to be revised at the last moment, guys. Do not worry about this question. It's fine. Okay. But when you read the explanation, do you see they ask you about the subtypes like clear, papillary, chromophobe. So try to recollect or try to go back through your notes. Like, see, they have given the classical triad. So what we'll do, let's go through our notes of renal cell carcinoma. Let's see, guys. Okay, if we go to the renal tumor, we have pediatric one, we have adult one. That is Wilms tumor, that is triphasic tumor. You have epithelial component, mesenchymal component, and you have blastomal component. Then coming on to the adult, guys, it can be classified either being a benign one or a malignant one. So benign, you have oncocytoma, angiomyolipoma, and renal papillary adenoma. And malignant, you have various RCC variant that will be discussed in the next slide. Now coming on to the renal papillary adenoma, nothing is important as such. Now remember the term oncocytoma. Whenever you had onco, that is rich in mitochondria. So what do you see in this image, guys? You have a central stellate scar. Do you see, guys? And the color, is typical appearance is mahogany brown. Okay, so this is very important. When you see the electron microscopy, guys, this crista may be seen on the mitochondria, and this is rich in mito, hence it has dense granular eosinophilic cytoplasm. Now coming on to the angiomyolipoma. Angiomyolipoma, what does name indicate? Angio means blood vessel, myo means muscle, and lipoma means fat, means it has everything. Remember, this is important. This is associated with TSC, that is tuberous sclerosis. Now when you recall TSC, think about the two gene, TSC1, TSC2 two gene, that is hamartin and tubulin. How do I remember? Hamara, tumhara. Okay, I think you can know. This is positive for HMB stain. Okay, guys, so do you see the image? See, fat is there, blood vessel is there, and muscle component is also there. Now coming on to the adult one, guys. Okay, so see, we have some important variant, like they ask us about the 6 variants. See, clear cell, chromophobe, papillary, collecting duct, medullary, and childhood RCC. So if you see the clear cell RCC, C is the third letter, hence it's the deletion of 3P. Hence, it is associated with 3-letter syndrome, that is VHL syndrome, von Hippel-Lindau syndrome. Okay, and a question that is frequently asked, which is associated with von Hippel, you have cerebellar hemangioblastoma. This is also one of the frequently asked question, guys. Okay, so try to revise the nearby topics that can be asked with you, guys. Now coming to the microscopy, you again see clear cells, that is filled of glycogen and lipid. See, that is most common. Now coming on to the chromophobe wala thing, guys. So here you have multiple chromosome loss. So how will you remember, guys? Chromophobe, that is chrome means color wala thing. So here you have Hell's colloidal iron positive. This chromophobe has perinuclear halo and resinoid nucleus, and this is associated with Birt-Hogg-Duke syndrome, and this chromophobe has the best prognosis. This colored wala thing has the best. Do you see? You can see the perinuclear halo in the image. Now coming on to the papillary RCC. So this papillary RCC, this is associated with dialysis. Okay, this may be a frequently asked question, guys. There are multiple mutation, and if it is hereditary, guys, okay, then it is known due to fumarate hydratase gene mutation. You can remember like this: Papa is fuming with anger. Okay, fume. Okay, now so see, papillary name only indicate papilla present, Samoma body. So try to recall. P for papillary RCC, S for serous cystadenoma, M for meningioma, M for mesothelioma, P for prolactinoma. You can see this is dystrophic calcification here it's present. Now collecting duct or Bellini, that has the worst prognosis. Medullary RCC, that is associated with sickle cell trait. And children like toffee, that is TFE3 gene mutation on chromosome XP11.2. So when you come across some staging question, you cannot remember the staging as such, but try to recall the nearby topic RCC, what are the variants, what are the important points that you need to know from those topics. That will help you revise the topic. So I think this on a whole gives you a good idea how to review your GT, what are the things you need to focus on, how to correct your mistake. So it's better to make mistake now, but try to learn from your mistake. Do not make the same mistake again and again. If you like the content guys, please like and subscribe to my channel. For more content, do follow my channel. Also multiple subjects rapid revision video has been incorporated in the channel. Do watch through those. It will help you a lot. Thank you guys. Happy learning. Bye bye.